how to recognize cues. Well, what are cues to begin with? What is that? Well, cues, I have another name for it. I call it identifying the key factors of an NCLEX question. So basically, you need to identify, you've heard it, you need to identify who the patient is, what is the patient problem, what are the clinical manifestations, do you have subjective or objective data, do you have keywords, is this a priority question, is this a case study question, what type of question are you facing? So a good next generation NCLEX tip I saw in one of the Saunders books: remember to recognize cues carefully, review the client assessment data like developmental age and history to determine if findings are relevant or of immediate concern to the nurse. I will tell you something about this next generation NCLEX. They're going to give you a lot of information. They're going to bombard you with information. They're going to give you a clinical picture this big, and out of that information, maybe a third of the information is important and everything else is blah, blah, blah. So if you don't develop the ability to recognize what is important, you're going to be wasting a lot of time with things that are not important. So you need to write those 5 key factors that I talked about a few seconds ago. You need to write them down, and you need to look for that as you review your question or your case study, whatever it is. Number 2, another ability that you need to have. You need to have the ability of analyzing cues. The nurse organizes and links them to the client's presented clinical situation. You need to ask yourself, what is relevant? What does it mean? And what does it indicate? See, in these type of questions, they are very difficult. And sometimes it even looks like, I would say, like almost diagnosing type of questions, like medical diagnosis. But the NCLEX doesn't really test medical diagnosis. The NCLEX tests nursing diagnosis, nursing implementations. But you could see questions like this. You can encounter a very difficult question like this. For example, they may say that you have a patient that came to the ER. This patient has weakness, acute confusion, the patient is dehydrated, and so on. And they're going to ask you what the clinical manifestations are, what is it telling you as a nurse. But you know what? It gets trickier. They're going to ask you how those same symptoms, how it relates to other medical conditions. The question could be about dehydration. The question could be about sepsis. But they're going to ask you how these symptoms described in the scenario also relates to other medical conditions. So now those type of questions take a completely different turn. Now it's not only about knowing about dehydration. You need to know how those symptoms that are related to dehydration could also apply to conditions such as hypernatremia or anemia. So as you see this question here, and if you're watching this recorded later on, pause it and ask, where do I see generalized weakness? And mark dehydration, hypernatremia, or anemia, and so on. You need to identify acute confusion. Where can I see those type of symptoms? Dry mouth, increased heart rate, dyspnea on exertion. So think about that, about this specific question, and check mark where do you see those clinical manifestations occurring, because this could be an NCLEX question that you could see on the Next Generation NCLEX. So generalized weakness, where do we see that? We're going to see it on dehydration, hypernatremia, and anemia as well. Acute confusion, we can see it in all of the conditions: dehydration, hypernatremia, and anemia. Dry mouth, dehydration, and hypernatremia. Increased heart rate, we can see on all of them. Whether dyspnea on exertion, we see it mainly in anemia. So this is an interesting style of question that you can see on the Next Generation NCLEX.